Try to figure out screen
No
sharing.
problem.
But hi, everybody. Thank you so much for joining. I'm Madhu Volamiri, Senior Advisor for Health and Families Policy in the Office of Governor Josh Stein, and I am serving as lead staff for this work group, which is Workforce Compensation and Supports. It's one of our three work groups. Perfect. I see the screen sharing. Thank you so much. Um, it is one of our three working groups that is kicking off as part of our task force on childcare and early education established by the governor earlier this year. So, if you don't mind advancing to the agenda, I will just give a preview of our time together between now and 4 o'clock. So, first, I'll walk us through some housekeeping and just work group goals, and then we'll start with a guest. Really excited to have Sarah Vanover from Kentucky Youth Voices to share a little bit more about how Kentucky was the first state in the country to pilot and expand childcare for early childhood education professionals, which is the recommendation that we'll be doing a deep dive on in today's work group meeting. Would love to spend time after Sarah uh, talks to just have some reflection from work group members, and then I know she'll have to leave. And then we have put together, the staff, some background in North Carolina, as well as landscape of what other states have done on this policy. And then we'll spend the last chunk of time really brainstorming and discussing what it would take to advance this policy forward and help flesh out an implementation plan. So if you move on to the next slide, I have just a few housekeeping things to go through. First is reviewing the state public records policy. As a reminder to work group members, please be advised that state public records policy applies to this work group as well as the larger task force. That means this meeting recording and notes that are produced from the meeting are a matter of public record. Again, if you're a work group member who's not a state employee and haven't yet had a chance to do your public records training, please reach out to me and we'll figure something out to get that scheduled. Next slide. Public meetings disclosure. I just want to remind everybody that this task force and work group meetings are public meetings. This meeting was noticed on the North Carolina Secretary of State's Office of Public Meetings calendar, and it's open to the public via live stream through the North Carolina Department of Commerce's YouTube channel. So just as a reminder to work group members, please be advised that this meeting is being live streamed and recorded. Next, I will read out loud the conflict of interest disclosure, which we also read at the top of the task force meetings. In accordance with the State Government Ethics Act, it's the duty of every committee member to avoid both conflicts of interest and the appearance of conflicts of interest. If any committee member has any known conflict of interest or is aware of facts that might create the appearance of such conflict with respect to any matters coming before the work group today, please identify the conflicts or the facts that might create an appearance of a conflict to ensure that any inappropriate participation in that matter could be avoided. And if at any time any new matter raises a conflict during the meeting, please be sure to identify it. Do any work group members have any conflicts to share at this time? Okay, moving right along. Thank you so much. Next, just to remind folks, our work group purpose. So the task force, as you all know, is charged with evaluating policy solutions, developing recommendations, and we have already issued our June preliminary report. We have a December report coming. And our work groups, in contrast, are engaging in implementation planning. So in June, one of the recommendations that we had put forward was around childcare for early childhood education professionals, and we will be fleshing that out here. So as you're listening to Sarah and thinking about the other states and what they have done, please be thinking about how recommendations could be achieved, who should be at the table, and what resources will be required. Next slide, please. And then finally, just a reminder that we are trying to follow the same principles of the task force. We want to show continuous progress, really bring a solutions-based approach, and think about public and private solutions. And at our next big task force meeting in October, we'll share a readout of what we did at this meeting, and we'll be able to capture the progress made in our December report. Next slide. Finally, I think just getting into reminding everybody that our work group is charged with three different recommendations that we're fleshing out. The one that we are focused on today, again, is exploring subsidized or free childcare for childcare workers. And with that, I think that is all the housekeeping and background. I would love to turn it over to Sarah Vanover to introduce herself and to share a little bit about how Kentucky got this off the ground and where things are at now, and then want to have time for a Q&A with our members afterwards. Thank you again, Sarah, for being here.
Not a problem. I hope everybody is doing well today. Um, I work for Kentucky Youth Advocates and I specialize in early childhood policy and advocacy. But during the pandemic, I was the Kentucky director for the Division of Child Care. And one of my main tasks was taking all of the one time federal funding and using it to try and prevent our child care industry from collapsing. um, And so many of you know there were different funding streams that were made for different things. Of course, there were subsidy payments that were specifically indicated for child care programs, but then there were flexible funds, and we were trying to use those to best support our workforce. Let me tell you a little bit about Kentucky. Of course, politically, the state, Kentucky is very similar to North Carolina. Size-wise, we're a little bit smaller. We have about 2,000 child care programs, and that's centers and family child care homes. I will tell you we're about 92% center-based. So with 2,000 programs, a lot of those programs have multiple employees instead of just family child care homes. We lost a lot of family child care homes around 2013 when we had a freeze in our subsidy program. And since then, many of the additional people in the field have been retiring. And so one of the things that we have been trying to do is to increase our family child care home numbers. But like most states, during the pandemic, we had a significant workforce shortage, as well as other issues with just getting access. We have 120 counties in Kentucky, and 79 of those counties are considered child care deserts and do not have enough child care for the children and families within the county that need it. And the majority of those are rural counties. Um, so that's a little background on us. During the pandemic, we were probably a year into the pandemic, and Kentucky was one of the 5 states that closed all child care programs and then had some that could apply for emergency certification to be open. But we were trying to get everybody back up on their feet after all of those closures. And it was about a year in, and I was looking at our subsidy numbers in Kentucky. Prior to the pandemic, we had about 30,000 children that were enrolled in our state subsidy program. And about a year into the pandemic, those numbers had dropped to just over 17,000 children. So a significant decrease in the number of kiddos that were utilizing child care subsidy. And I've worked in the field of early childhood education for 27 years in different roles as a teacher, a director, professor at the university level, working in state policy. So I have a lot of friendships with directors throughout the state, and I picked up the phone and I started calling people, and I was asking them, why aren't you taking our subsidy kids? Like, what's going on? Why are our subsidy numbers dropped? And they said, we haven't stopped taking subsidy kids. We're just not taking anybody. And what it looked like was so many staff members had left that 2 and 3 classrooms were closed in a lot of child care centers, and they had wait lists that were enormously long. And as many of you remember, around that year mark, a lot of businesses had inflated their wages. Places like Arby's and Wendy's and Target had gone from $10 an hour to $17 an hour. Well, in Kentucky, we are a state that uses the federal minimum wage, and a lot of our child care providers prior to the pandemic made less than $10 an hour. They might have made $9 an hour. And although chain retail and hospitality organizations were increasing their wages, childcare was not, because most of our childcare are nonprofits, faith-based organizations that did not have the extra money to put into wages. They were barely keeping their doors open at that point. Um, so childcare providers were leaving. They were looking at the pay differences. They were saying, I'm making $9.50 an hour here. I can make almost double that stocking shelves at Kroger. Why am I still here? My family needs this income. I'm leaving. And so As many of you know, data from the Annie E. Casey Foundation shows that 98% of other professions make more than childcare providers, and that includes dog walkers. I mean, we have extremely low wages for men and women that work with our children and do such a wonderful job of caring for them and educating them. But it's hard work. A lot of childcare providers take work home. They're cutting out construction paper pieces at night so that they can do art with the children the next day. They're working with parents who may be emotionally flustered that their child came home in somebody else's pants and what happened and why why did this person have different emergency pants than they were, all kinds of things that a child care provider goes through on a regular basis. And stocking shelves or working the window at Starbucks just started to seem really appealing. With the retention issue and then another issue of just general recruitment going on, we were just hemorrhaging people. Most of our child care providers in Kentucky cannot afford health insurance. The businesses don't have the ability to offer it health insurance, and if they do, the child care providers can't take $300 out of their own paycheck to pay premiums. So um, if they were lucky, they got an hourly wage in childcare and then potentially some paid time off, but that's usually the only benefits they had. Again, like I said, I'd worked in childcare programs a long time. And one of the best recruitment tools that childcare programs often offer is a discounted rate at childcare for their employees. So a childcare program may say, hey, I'll take 50% off your childcare for your children if you come work here. And for a parent who needs to work and also has to pay for childcare, that's an amazing offer. And for the parent, the benefit is I'm there in the building with my kiddos. This is a great fit for a nursing mom or a parent who just wants to spend more time with their kids. Or maybe you just want to be a parent that gets to go on the pumpkin patch field trip and you can do it as a staff member instead of having to take off work. And so this has always been something that child care programs have tried to offer. But let's say you have 8 staff members who each get 50% off. You've just lost 4 full tuition slots, and that can be the difference. That income can be the difference in staying open and closing your doors. So, childcare programs want to do this, but there's a limit to what they can do. And thinking about that for me, I thought, well, what if? What if we could still give that benefit to child care providers? We could say to the people that work in the program, you can get a discounted tuition rate or you can get free child care if you work here. But the program itself, the business still got the full amount of income so that they could keep their doors open. And at the same time, we're going to lose the sustainability payments. We know that those have a federal end date, and the federal fiscal year was approaching when they would run out. But if you're used to discounting your staff's payments, and all of a sudden somebody picks up that extra 4 tuition slots for a year, and it ends up being $40,000 that you get to your income, that's almost like a sustainability payment within itself. So we started thinking about this, and I'm like, okay, if I made $15 an hour at Target, but I had 2 children in childcare that I had to pay for, then how much am I bringing home? Versus if I made 10 an hour in childcare, but I did not have to pay a cent for my children's childcare, would it be more? And then would I have those intangible benefits like getting to see my kids during the day? So I pitched the idea to our secretary and said, why don't we use some of these federal funds to waive childcare costs for childcare providers who work at least 20 hours a week in childcare programs? And that's the same requirement we have for our subsidy program. You can apply for childcare subsidy if you work at least 20 hours a week in a childcare or in the workforce somewhere. So the work requirements would be the same as any parent, but specifically to working in this program, the state would cover the subsidy regardless of outside income. So in this case, many child care providers qualify for subsidy because their rates are so low. However, some may have a spouse or a partner in the household that puts them just over the edge and then they don't qualify. But with recruitment now, we're trying to get those people to come back to the field. So what if we didn't count any other income? We just said categorically, you're a child care provider, you work 20 hours a week, we're going to pay for your children's child care. and then you would have that benefit along with your hourly wage. And so in October of 2022, the program began. By that point in time, I had already left the Division of Child Care and I was in the private sector when it finally launched. But I got to see it come to fruition, which I was so excited about. And Kentucky child care providers now, in 2025, we have 3,500 child care providers in the field taking advantage of this, and we are caring for 6,000 children. So that means that a large portion of those providers have two kids that are getting free child care, and it is totally worth it for them to be attracted back to the field and get to work in the child care field. Now, for me as a past child care director, this system sounds awesome, but now I have to pitch this idea to a legislation, uh, a body of legislators, and talk about the return on investment. And this is where it gets really cool because it benefits everybody. If you want more workers in the community, we had so many businesses in Kentucky that came to Kentucky during the pandemic. And every time the governor would get on the news and say, Ford has decided to do this major expansion, or App Harvest is coming and opening these mega greenhouses, or we've got a new battery plant. And he's all excited saying, I'm going to bring this many jobs to the state. And I'm thinking, where are we going to put these kids? Like, families aren't going to keep moving here if we don't have childcare. But if I'm saying, okay, we're going to pay for um, one child's childcare so that their parent will come in, or maybe potentially two. But let's think with one child, if we bring in one adult, they can care for 10 children on average, because younger children's a little bit more preschool. It can be up to 14. So if we say for every one adult we bring in, we pay for their child, then nine more families enter the workforce because they can care for nine more children. That's nine more families that are filling jobs at local businesses. That's nine more families that are paying income tax. Kentucky has a high number of individuals who are able to work. They're in the 25 to 45 age range where they're healthy and they're able to work, but they don't because of barriers to the workforce. And these aren't individuals on unemployment insurance. They're just people that have chosen not to work because of these barriers. And the number one barrier that the Chamber of Commerce in Kentucky hears is childcare. Number two is affordable housing. So what if we took that childcare barrier away? And then that person can bring in all these additional people, and then nine more families are working. And the first year of this program was funded through the American Rescue Plan, but in Kentucky, well, a year and a half. In Kentucky, we do a biennium budget. So 2024 was the first year that we did not have American Rescue Plan funds, and we had to really um, get more investment in childcare to keep these types of initiatives going that we started during the pandemic. And may I say, Kentucky is very fiscally frugal. And all of my time working in the field, Kentucky has always been a state that gave the minimum state match in order to draw down all of our federal dollars from the Child Care and Development Block Grant. So we did not have tons of extra state funds that went into this. But in 2024, we were given a lot of state general funds to keep programs like this open because we had seen the benefit and the return on investment. And even with a very conservative legislature, we have an 80% Republican legislature, 20% Democratic. Chair of our budget committees are very very frugal gentleman. But the chair of our Senate Budget Committee specifically mentioned this program, free childcare for childcare providers, and said this is the kind of innovation that we need and that the legislature wants to fund, because it's not just throwing money at a problem, it's figuring out a new way to actually solve it, and to help working families, to help the childcare industry, and to make sure that our children are healthy and safe. And so we got 2 more years of funding, $20 million to continue um, this program. And we're coming up on another biennium budget in January. And all of our legislative members have told us that the families in their community and the child care directors say that this program is working for them, that their retention is up, their they don't have as much turnover with staff, layered with our state scholarship program, which has been in effect since 1996. If you work in a child care program 20 hours a week, you can qualify for a scholarship to go to school. I was one of the first recipients of that in 1998, getting my undergrad in early childhood. But layer those two together and think free child care, free education, and you have a way to draw people in and support them beyond just a very low wage. And we've been really successful. After we launched this, we started having states. I've had 38 states contact me in the past couple of years asking how they could implement this. The first state after us to implement it was Rhode Island, and then they've just like ticked off. This is the third conversation I've had today about this actually with different states and committees that are looking for ways to improve their child care program without just endlessly funneling money, but actually trying to find a way that they can have return on their investment as well.
Thank you so much, Sarah. Really appreciate that. And it's amazing to see the work that you guys have done in Kentucky. Um, I would love to open it up to our work group members to pick your brain and ask any questions about how you got it off the ground or anything like that. Opening it up, please just come off mute.
While you're thinking, I will tell you that in Kentucky, we have one system where you go and apply for all benefits. It's called Connect. It's KYNNECT, like, kind of quirky name there, but you can go to Connect to apply for Medicaid, to apply for SNAP, to apply for TANF. And so child care subsidies run through that system. The child care providers still have to apply through Connect at their local DCVS office. They have to bring in proof of their income. And for individuals that we find that are already income eligible, we route them that way first so they can use the federal funds. We found a lot of people came in and applied and qualified through income and didn't even realize it. And so we were able to then save the state funds for people that didn't qualify through income. And then they have 1 year eligibility and they have to come in every year and prove um, work participation, show income, those types of things.
Sarah, this is awesome. Thank you so much for sharing. And this is Rhonda Rivers. I heard you say that some of the information that you provided was that you provided the data that said that when you get one teacher that finds that it makes sense for them to come to the workforce, being that they are able to have their children cared for at no
Mhm.
additional cost, that would put a nine or so additional employees back in the workforce. What else did you present before them that what was a real game changer to change those conversations that made them really start to lean into this idea?
When we went before legislative committees, first of all, we had data from the numbers for about a year and a half that was funded through the American Rescue Plan. So we had enrollment and were able to show what those numbers looked like over time and who was taking advantage of it. We also had a lot of child care directors give testimony on how their staffing had changed during time. And we had child care program directors that were able to come in and say, I opened 2 rooms that were closed. I now serve, two more rooms of 24 preschoolers, so 48 more children because I've hired 4 staff members. Looking at kind of that data on how their staff turnover has gone, and so that helped a lot too when we went to committee. But the return on investment model and just showing what that looked like throughout the state was especially helpful because it did show that it could have a direct impact at the community level.
Thank you.
Other questions?
I have a few questions. Um, Harlan Salisbury, I'm with Senator Chaudhry's office. My first one is you mentioned, and maybe you might have already said this, so I apologize if I missed it, but you mentioned, the federal funds are running out for this program. So what do you expect the state to pay to maintain this program?
So the federal funds ran out, and in 2024, that was the first time that the state invested. They
Okay.
put in 20 million for the biennium, and we have not run out of that so far. Of course, our biennium with the state budget will go through June 30th of 2026. And then the legislative session will start in January for us, and we'll look at another 2 years. We have no opposition to this program at this point, and that's unusual for us in such a conservative fiscal environment. The regulation does say as funds allow. So say we budgeted 20 million and it completely ran out, then we wouldn't be able to accept any more people until the new budget cycle started, or unless the state reappropriated other general funds for the Cabinet for Health and Family Services or something of that nature to support it. But so far the budget estimates were pretty accurate. We estimated going in that it would be between 6 and 7,000 childcare providers. And we kind of made the general estimate looking at, so we do a um, market rate survey, which North Carolina does as well every 3 years, to find out the overall costs in the market of childcare, from infant care being the most expensive and to after school care being the least expensive since it's part-time. We averaged and used $200 per week as a general number because it would be halfway between like the most expensive infant care and then after school care. And so estimated for every child, we charge $200 a week for the year for the 52 weeks, and then kind of propelled off of there how many children that we thought we could serve. And then we've been right around, I think the last time I saw it was like 6,087 children that were currently enrolled. Um, and so those estimates after the first 6 months, they stayed pretty constant. They did increase a little bit during the 6 to 12 month mark, but the first 6 months was a dramatic increase as people heard about the program. It took a while. Child care providers were calling us, said, I heard about this. I think it's an urban legend. Can you tell me if it's actually true? Trying to get the word out and get everybody enrolled that first 6 months was tough, just because our child care providers aren't necessarily connected to the Cabinet for Health and Family Services and a lot of that information. And programs like this, you get money for direct services, but you don't necessarily have an advertising budget. So we really had to work hard to get the information out to people during that first 6 months. And so the increase of enrollment really was very steep as more people heard about it and more people came in. But after the first year, we've stayed relatively level. We are doing things to try and increase access to childcare throughout the state. So if we do have dramatic increases, which we haven't had thus far, but if we do have dramatic increases, we may see that we need a slightly larger budget in this area, but just initial estimates allowed us to kind of get that number.
Thank you. And I think this ties into my second question is I know Kentucky rolled out TriShare, which we've piloted in North Carolina, and we got about $1 million in funding. And I know from other meetings, it sounds like this could TriShare aligns with kind of this similar rollout of this program. But I know one of the issues in North Carolina is like the enrollment. It's been really hard to advertise TriShare and get businesses on board. And I was wondering how this program aligns with TriShare in Kentucky, and have you run it like experienced any problems in Kentucky with TriShare?
So ours is called Employee Child Care Assistance Partnership. And it's slightly different than like the Michigan Tri-Share model because the employer can just decide what amount they want and the state will match it. So if the employer doesn't want to do a third of the child care, they don't have to. They could say, I can give $100 per month per employee. The state would match that 100, and then the parent would pay the balance. So if the parent pays $1,000 a month, and the state and the employer take 200 off of that, parent's responsible for 800. But let me tell you, when I had two kids in childcare at once, if somebody had offered to pay 200 a month, I would have taken them up on it. Our rollout has been slow, and a lot of businesses are just scared to change their human resources policies, honestly. We've had some uptick. The budget for our version of the TriShare program has been about 2 million a year, and we have not surpassed that. Part of that, again, is because we have money for direct services, but not advertisement. And so we really, in this budget session, we are asking that a third party be tasked to run the TriShare program, and that they have the ability to advertise to businesses. The first year that it was out, I think I went to almost every chamber in the state, and we have 120 counties and like 80 different chambers. And I feel like I went to about 60 of them. And every time I was in the room and I explained it, people were like, I've never heard of this before. We're like, why? Why haven't you heard about it? Um, so we were trying really hard to get the word out, but we just didn't have anybody whose staff allowed them to dedicate full-time work to this. So we're really hoping to make that change in the upcoming session.
Thank you.
Sarah, I have a question about the decision to open it up to all early childhood education professionals. I think maybe some other states have limited it to teachers. Was that a decision point that you all had to think through? And like, what was the thought process, pros and cons for
For me,
going
it was
broader
never a
versus narrow?
decision. For me, it was never a decision. Every single person that works in a child care program is essential. And if you don't have somebody working in the kitchen, then the director is going to have to make all the meals instead of do their job. And the director doesn't get to support the teachers. And it's a chain effect. I did have to defend that decision to our administration because they were like, well, we need teachers. And I'm like, you don't understand. Everybody who works in a child care program works with the children, because when the nutrition specialist is done making lunch, then they give all the breaks for the staff and work with the kids during nap time. And the director and assistant director, they are in the classrooms all the time supporting the kids. So all of this is essential if you want the business to work. And I was able to convince our administration that it really is important for every role in the center. I know some states have just done teachers, but I think that when you're thinking about adult to child ratios and who's supporting them, everybody in the center at some point factors into those ratios. They factor into being in the classroom with the kids, whether they're just there to give lunch breaks, whether they're there to support teachers. It's just something that if somebody is not there to fill a certain role, it all gets shifted around. And so it's essential to support every member of the team.
Very helpful. Thank you. Any other questions from our group members?
I would ask Sarah briefly if there's anything that you would do differently that you think would get the attention more, or just any challenges that you found along the way that you would share that information that we should consider.
Yes.
That would be
Uh,
great if you had anything to share.
and I think I shared this with Madhu already, but the first couple of months were a little bit rough when child care providers went into their local DCBS offices to apply, because their directors had told them that they could get this benefit, but not all of the DCBS staff were in the know. And so the child care providers would go in to apply and they would tell them, no, you don't qualify. And then the child care providers, their director was working in the classroom for them so that they could go and apply, and they would come back and then the directors would call and yell at us. So like the first 2 to 3 months, just making sure that everybody on both sides of the equation understood that was the biggest challenge. And we sent out memos. Well, I had left around that time, but the cabinet for health and family services sent out memos to all of the regional staff telling them that this went into effect. But I feel like um, it should have been prepped a little bit better for them, maybe at one of the quarterly trainings where they get face-to-face time and just say, look, this is happening. Don't turn these people away. Because that was the biggest issue. Directors really had a hard time, because these offices are only open from like 8 to 4. So they're open at the same time that the child care providers are. So directors would have to let their staff off work to go apply, and they were doing it because they wouldn't have to give discounts anymore and they would get their full tuition. So they were on board. But if they let them off for 5 hours to go do this and then nothing happened, then they were really frustrated.
That's a really good
Thank you.
implementation point. But it sounds like once people realized this was a real thing, it really took off, and you kind of had that initial confusion, but we're able to kind of get past that.
Yeah, after the first couple months, once everybody finally realized we weren't pretending, this was actually happening, and then our regional staff were prepared to help them apply. After that point, it's been smooth sailing, and we have a child care director that is in our Senate, and he has so many times told our families and children committee, like, this made the difference in me being able to staff my facility. There's no going back. This is this is the way to do it. And it is just a lot of people will tell you that they can hire the staff that they want now. Now, it hasn't completely solved staffing. I mean, when you have a low wage, it it's challenging, and we want wages to match. I'm jealous of North Carolina's wage supplement program. That is something that Kentucky, I have begged and begged for. To paired with that wage supplement, if you were able to add this, I think that your providers would have so much support. It would just be a wonderful layering of benefits together.
And Sarah, another implementation question. Did you do it statewide right off the bat, or did you ever pilot it in parts of the state?
We just went with it and took off. It was the whole thing because we were working so hard for that retention and retainment at that point. We had people that had been in the field 20 years who were thinking about leaving because, the grocery down the street was paying more, and we had to find a way to keep the staff that we had and bring people back from other industries. So we launched the full thing at one time.
Other last questions for Sarah? All right, well, then I'm going to thank you, Sarah, very much for your time, for all that you have done for the state of Kentucky and continue to do, as well as inspire other states to learn from the work y'all are doing. Thanks so much for the partnership, and we really appreciate you being here and sharing some of your wisdom with us.
No problem. And if you get to advance with this, to help on regulatory language, the administrative side, feel free to reach back out to Kentucky. We would love to help and see more child care providers get to take advantage of this.
Thank you so much. All right. I am going to move us on to just taking a few minutes to reflect on what we heard from Sarah, and we'll have some of these discussion questions towards the end again too, after I go through a little bit more of the landscape of what some other states have done. But I wanted to use this time while it was fresh, while you heard from Sarah, to just hear any thoughts or reactions. And these are the kind of questions that we're trying to think through as we develop an implementation plan that can be part of our December report. So very interested to hear just general reactions and thoughts, but also anything along the lines of, what steps or resources do folks anticipate would be required to implement this kind of a program, and maybe more key for where we are right now, which is still early, what additional information would we need to develop a more detailed proposal around this? I'll open it up to you all.
Uh, Madhu,
Yes, Rhonda,
and I want to apologize in advance again for the background noise. I'm away, and just so if it gets too loud, let me know, and I'll try to find a quieter
you're
spot.
fine.
But
You're
thank you
fine.
so much for bringing her on. That was very helpful. I am assuming and confident that we probably have data that would give our legislators insight with a fair ask for how much it would cost us, considering how many providers we currently have, and or some sort of an estimate of how many children those providers have, so how much it would look that we're looking to ask for. Is that information we already have, just to considering what we have now? How many
Yeah.
is for? Okay, all right.
I'm going to share what I have gotten from a couple of groups. The CCRNR and NC Child worked to do a survey earlier this year, so that we at least they have put together some kind of preliminary numbers. Think a little bit more work to do on cost, but certainly I think they could help us come up with rough estimates based on the number of kids and adults. So I will go into that after um, after this portion.
What, Madhu, would you also go into, I think some of this has been proposed in bills before, like putting so much money
Yes.
aside. So you'll do that. You'll go over that as well.
Yeah.
All right. Thank you.
So
Thank
why
you.
don't we move this along, and we can save time to come back to these questions after I kind of go over a little bit of the North Carolina landscape that we do know, and we'll try to quickly cover what some other states have done. Some have done slightly different models than Kentucky. So Just before I do, any more burning comments or reactions to what Sarah shared, or any questions that it left you with? Okay, then I'm going to keep moving us on to talk a little bit about what we have with the North Carolina landscape. So first I'll start by going into the survey that I mentioned. So in preparing for this meeting, I spoke with Christy Snuggs with Early Years, and she shared with me the NC Childcare for Childcare Workers Provider Survey that they did Early Years in partnership with NC Child in March, and it went to 4,300 childcare centers and homes. They had a 29% response rate, and collected data in March. And it was specifically around the idea of modeling a program similar to Kentucky, and what programs, what impact or outcomes they thought that would result in for their staff and their programs if we were to do some kind of subsidy for employees in licensed childcare. So on the next slide, the survey made some assumptions that the program model would be modeled off of Kentucky, so available to all staff working in childcare who are working at least 20 hours per week, similar to the Kentucky model, and no typical subsidy income cap. Next slide. So what they found in their survey is that close to 80% of childcare providers said such a program would help them hire and retain staff. Can't see it all that well, but the orange is saying 85% thought it would help them hire needed staff, 83% thought it would help them retain current staff, and the other kind of positive outcomes are that it would help keep their program open, add more slots, and open classrooms. So a number of different perceived benefits. Next slide. They did come up with some initial estimates around how many employees and kids that might be kind of the universe here. And so they estimated that there might be 7,300 licensed childcare employees of all types who work 20 hours or more, and have an estimated 10,500 kids under age 6. And I believe they used some census data to come up with the child estimate. So it is an estimate, not an exact. But they also, as part of the survey, noted that what is happening currently is that 61% of the childcare programs surveyed are already offering discounted childcare. About 82% of the employees are receiving some kind of discounted childcare. And they estimated that these providers who are already offering the discounts, that is totaling close to $31 million. That the providers are investing in their employees, but you could also view as they're losing that revenue because they are not able to get that tuition because it's going as a discount. So I know they're working to assess more costs on this, and we can certainly follow up and get more information. But if we go to the next slide, I'll touch a little bit on what you asked, Dan, which is covering HB 800, and Representative Willis, I think, unfortunately wasn't able to join us today. I was hoping he might be able to speak to it as a sponsor, but I'll try to hit the highlights, which is that this bill, which was proposed but did not move forward in our session, proposed 10 million in non-recurring appropriations per year, so that's 20 million over the biennium, for an automatic childcare subsidy pilot to make folks eligible for their preschool age children 8 weeks to 5 years if they were full-time, meaning working at least 35 hours a week. The bill was specific to childcare teachers employed in a licensed childcare program. So I think a similar amount of money is what Kentucky did. They also said 10 million per year. But different in that it was focused on teachers rather than all of the employees in a program. And the bill proposed to have the teacher become automatically eligible if they have completed or enrolled in the first available semester of intro to early childhood. So there was a connection to early education learning. And then it was proposed as a pilot, so not statewide, but select counties, focusing on those with the highest percentage of childcare capacity lost in the past 10 years. It also said in the bill language that the child care programs wouldn't be able to charge parent copays or other fees, and that counties should use existing subsidy before leveraging this additional funding. And that kind of speaks to the point Sarah was making, where they had a number of childcare providers who actually already qualified for subsidy but didn't realize it. And so I think they similarly set up a model where they tried to have folks pull from the regular subsidy pot of money first if they could before they went to the additional funding. So I will pause there and just see if there's any questions from folks before I talk about some of the other states. Any questions about either the survey that NC Child and Early Years did, or about HB 800 that we can note down and bring back to others if we don't have the answers? Or if anybody has any additional context on that survey, which you certainly might have more than I do. I know we have Representative Chaudhry and Representative Crawford on the call. I don't know if you have any insight you could share about helping us understand, is HB 800 still possibly in play, or was it one of those that didn't make crossover? I'm still trying to remember how that works.
I am pulling it up now, just so you know.
Thank you.
Yeah, it did not make crossover, so it would have had to pass one of the chambers or the other. So it did not make crossover in the sense, you can't see me, but I'm doing air quotes. But I mean, it doesn't mean it couldn't be put into a conference report. The challenge is, of course, we have all kinds of things that need to be dealt with that are outside of this.
Thank you. That's helpful to just understand the realm of possibility.
Sure. I mean, here's what I'll say about, anything that, got kind of held up in long session this year is that, I think the remainder of what we have for short session, and Senator Chaudhry can chime in here if he disagrees or if he agrees, either way. I think the remainder of short session is going to be mostly to deal with unresolved budget issues, Western North Carolina things. I would say anything like this, we should kind of look towards short session to deal with as we head into 2026.
Very helpful. Thank you, Representative Crawford.
Yeah, Madhu, I agree with Representative Crawford. I mean, I think short session is fine. I mean, I worry a little bit about the appropriations, the dollars tied to this, because it just, I mean, much like so many other childcare issues, I mean, it's just, I mean, as you know, it's been hard to find money, especially when there seems to be a real disagreement about tax cuts between the two chambers. I mean, I think they're great sponsors. I mean, I was talking to a couple of the sponsors today, and it seems like there hasn't been much movement on budget discussions because of those disagreements.
Appreciate the healthy sense of realism. But I think the work we're doing here is still to consider the possible and the big goals we want to aim for. So I think we should keep charging along. Any other comments? Okay.
Hey,
Go
Mother,
ahead, Susan.
Susan, I'll jump in. Hi, everybody. Sorry, I was a little bit late. I think to that point, I'll just say, I think it's going to be really important and this may or may not be within the scope of this task force, but I do think from an advocacy perspective, the question is going to be, what are the priorities for childcare fundamentally that we really want to push for? And so I think the earlier survey was illuminating, and that, the childcare business community felt like this would be helpful to them in retaining employees. And I think that's really important for childcare stability and for the workforce. And I just think that would have to be juxtaposed against other kinds of priorities, whether it's around childcare subsidies or the rate floor or other kinds of professional development things. So for me, this really, the program is a great program. It's a highly worthy program. I think it's really important to use our federal CCDF funds first for those who are eligible for childcare subsidies, and then for those who aren't, it would be a state funding issue. And to me, it just comes down to a question of advocacy priorities, and then what is possible within the current legislative environment.
Thanks for that, Susan. All right, well, I'm going to move us along to just cover a little bit more of the other state landscape so that you can get a sense of what are some of the other kind of models or parameters that states have differed on. And then again, want to go back to those discussion questions to think about what resources would we need to bring forward, who else needs to be at the table, what steps would need to happen to make this possible as we think about laying this out in December for our larger task force report. So if we move on, there are a number of states that have done some version of childcare for early childhood education professionals. You can see the list here. Kentucky was the first, and then you heard Rhode Island was next, and then many others doing it in slightly different ways. So I'll try to cover those quickly, and I will send these slides afterwards so folks have it and can be thinking as well. So on the next slide, there are 3 of these slides covering a high-level overview of the different states. Kentucky, we already heard from them. They used their ARPA money and then were able to get $20 million from their legislature to expand it over 2 years. And it was for all ECE staff. They made childcare providers a protected class within their funding, and it was a statewide model. Rhode Island got $4 million from their legislature to start a pilot, which has now been expanded and funded through 2028. Similarly, all ECE staff, also 20 hours a week or more. They did have an income limit that they added, unlike Kentucky. Similarly, did the protected class. They have a parameter where you have to go through a non-ECE application first. And then also, like Kentucky, no copays and statewide. North Dakota, I don't know how much they allocated just for this portion, but it was part of a larger 66 million investment in childcare in 2024. They had a slightly higher number of hours per week, 25 hours, but again, all ECE staff, not just teachers, leveraging their existing CCAP, which is Child Care Assistance Program, aka our subsidy program. Similarly, no copays and statewide. And I think they have a maybe higher age range, kids under 12. Next slide. Texas, I believe Texas is one of the more unique models. They did not actually include additional money for this, but they passed SB 462 in May of this year. And what their approach is to give priority on the child care subsidy waitlist for early childhood education professionals, rather than making them a protected class with a separate pot of funding. And so this is effectively where the childcare professionals are kind of getting top priority on the subsidy wait list. New Hampshire had about $2.3 million appropriated for the first year of their pilot and had to do some system updates for technology as well. This one is also for all ECE staff, similar to the other 3 states, protected class, different than Texas, statewide. Iowa was a 1-year pilot that was extended to 2025. And then again, don't have the dollar amount, we'll try to get that number of how much they invested. They have the highest number of hours that's on this table so far, 32 hours or more at a licensed center. Or at a child development home provider. And then again, working through the normal subsidy process. And the metrics they have is that as of 2025, they've been serving over 900 families and 1,500 children through the pilot. That one we'll have to figure out if it was statewide or if it was just in part of the state. Next slide. This is the last set of states that we have. So Utah, they have passed a bill to do the Kentucky model, but they haven't actually gotten the funding yet, and it has not been implemented, but they've estimated that it would be $2.5 million. Washington also passed a bill with no additional appropriation. They're expanding their subsidy program to all certified childcare providers and Head Start providers under a certain income limit, and waiving the copay. This one, I'm not 100% sure if what that means is if is it like the Texas model where people get priority or not. So I will dig into that more unless somebody else knows. Arkansas, they got a waiver to use their CCDBG funding for early childhood education professionals, and they have a wait list. It's for folks 20 hours per week, but the childcare workers who are working 10 hours or more could qualify if they're under a certain income level. And then finally, Maine got $2.5 million from their state legislature for a 2-year pilot. Also, all ECE staff working 20 hours a week. They have some prioritization criteria if they have a wait list. Don't know if they've had to go to a wait list or not. And so I think what you can see from these states is a lot of interest in this kind of a model. States are at differing levels. Some have been doing this for, well, Kentucky is the farthest along, but it's all still relatively new. Some have made choices about whether the number of hours per week you have to be working. It looks like most of these have applied their program for all the ECE staff and not just teachers, but we can double check on that. And then some differences of opinion on whether they are doing that prioritization model. Like Texas is probably the most unique than compared to these other states that have set their childcare providers as a protected class to qualify for subsidy. So I'm going to pause there. I thought I saw Senator Chaudhry put a comment in the chat about Iowa. Do you mind speaking to that?
Yes, I, Susan Gale Perry she might have pointed me to this, but I feel like the dollar amount in Iowa was significantly lower. But I felt like when we were looking at ideas, the pilot model of helping to defray the cost for childcare workers was an interesting one. So as I mentioned, we introduced this bill for a $30 million pilot. That was kind of based on the Iowa model, and the link to the bill is found in the chat.
Thank you. I will make sure to include that in our list of relevant legislation, and apologies for missing that one, Senator Chaudhry. I'll move to the next slide, and really this is just opening it back up to discussion. I think if you go to the next slide, would love to hear any other thoughts about, if there are strong feelings about what kind of a model could work in North Carolina. Obviously, there are resources that are required to get this off the ground, as we have seen in other states, and we can certainly do some work with other groups to come up with some estimates. But interested to hear if folks have thoughts about other resources beyond the funding that is needed, and other steps that might be required to implement this, or even, just not necessarily going all the way to implementation, but are there steps that we as a task force and body would recommend putting forward to kind of build buy-in, build the case for this kind of a policy? Maybe learning any lessons from Kentucky and what they were able to do with kind of the way they frame their return on investment. So I will pause here. Would love to hear any kind of reactions or thoughts about what kind of concrete steps we could consider taking to make this policy to move it further along the path.
Well, I just wanted to say that, first of all, these slides and this information on the other states is so incredibly helpful because it shows us what's possible, right? And I think it opens up an opportunity for us to talk about first, and I'm also grateful that we have our representatives that are part of this work group. So maybe if they can just give us some guidance as to what they feel like would fare better with our politicians, because I think considering with our representatives, considering all that we see here as options, the more we can tailor it based on to meet our needs, but also given the dynamics that we're working with people that we've already heard from. So grateful that we have Representative Willis that's leading some of this work, but just as considerate as we can be. And full disclosure, again, I'll just say this, just make sure I am a provider, right? And so the impact of this looks is it would impact my schools directly. So I do want to say that. So I'm not gonna, of course, I wouldn't be voting on anything, but I am reflecting on the needs of everyone, not my program. I know providers that will not hire um, parents or teachers that need childcare, that well, they will hire them, I'm sorry, but cannot afford to provide any type of assistance at all. So that just increases their turnover. They're not able to recruit the same level of talent because teachers can't afford it. So I'm just saying that the more, if we can just take a look at some of these things, I think maybe there are a couple of tweaks that we can consider based on what budget we feel like would be most likely. I am all for reaching for the stars in this, but I also want to put something before them that we feel like, hey, this is a win-win for everybody. It doesn't cut out some of the other things we're working on, like Susan Gale Perry mentioned, but it also helps us be able to create a situation where we get parents back to work and we can bring people back into the workforce, retain and recruit. So really excited to hear from our representatives on this as we talk, and other providers. I know Dan is a provider as well, and we can just provide a lens to be a voice for all providers in North Carolina, not for our particular program.
Hey, Rhonda, I got a question for you. Do you think that if I'm wondering if, since we're concerned about money, obviously,
Right.
what if there's buy-in that the voucher system could offer like 50%, and maybe the center has to buy in too and give the employee the 50% discount. But you're saying that some of the providers you've talked to couldn't even afford like a 25% discount if the state was
Yeah.
willing to do 75 or 50.
Yes, and I want to say thank you, Dan, for asking that. I have provider friends just in Mecklenburg County that I'm thinking about as we talk through this, that they say it's not financially feasible for them to do any part of it. So I do think I love what Kentucky has. That is absolutely the pie in the sky for me. But considering our landscape of who we're working with, I do want us to talk through it just a bit more. Like I was thinking before you provided that slide, Madhu, that maybe we look at a 25-hour model. That's just one suggestion. Um, and just to make it for those, so I don't want to take away from those that are really spending quite a bit of time. And because again, we're talking about a large expense. So we can look at
Right.
something. I don't think 50% would be enough, but I think maybe there's some wiggle room for us to think about a number that will make it more difficult to say no to, because we know we can get those resources. I see an opportunity to increase the hours a little bit. I think 35 hours is too much. Maybe 25, there's a little wiggle room there. And we can talk through some of the other components of some of the other states. I think we need a little more than 50 though, Dan. Yeah, but to your point, thank you for raising that. But and
I'm just
I
trying
want to
to.
aim for 100. I don't know if it's an age range. Yeah, I know I saw one of the states that they went up to 12 years of age. So and I can't see the slides. I'm looking on my phone. Can you, what, do you know the age of that
Yeah.
Kentucky went through? Um,
Can you go back a couple slides? Let me see. Kentucky. I don't have that off the top of my head.
okay, no worries.
Um, Several states. So North Dakota had up to 12 years. New Hampshire up to 13 years. Washington up to 13. Um, I wonder if any of them did under 5. So we can, as we're
Okay,
continuing to flesh out this research, we
okay.
can make sure to figure out what age ranges, but that might be
Yes.
another kind of way to narrow it down.
Yeah, yeah. Again, I just want us to work together with all the voices that are at the table with our different scopes of work to make this such that it's a almost impossible to say no, because it is absolutely needed to recruit and retain quality teachers and create a win-win. Being that there are other areas that we can accommodate, how we can increase pay for teachers to be able to recruit this workforce, this is certainly something that would be a win in the industry and for the state and for parents that need to get back to work.
Thank you for that. Yeah, I think that's a helpful kind of frame to think about, like, what is kind of, one way to think of it, what's the minimum viable product, the way that we could do this that would still make a difference and help kind of demonstrate that it's having an impact, but be something that could be more palatable to get some
Yes.
investment in.
Matthew, I had a kind of going back to the different state examples. A couple questions going in sort of a couple different directions. One was, did any of the states target it as a tax credit or incentive?
I don't know off the top of my head, Mary Elizabeth. We can check on that, but say a little bit more about what you're thinking.
Well, one would be that to the extent that this would require an act by the General Assembly, my first question is just what's the balance between putting forth what we think is the best and most successful program combined with, what is most palatable to, the General Assembly. And if a direct appropriation to start up a new program isn't something that we think would be supported, and I'm not saying that, but I'm saying if we're at that conclusion, is there an alternative that might, such as a tax credit or a structure like that, that I can understand might not be the first preference of providers or even parents, but might be something that could be structured in a way that is less money up front.
Got it. Yeah, so just trying to think of some alternatives. We can definitely look into whether that was how any of the other states did it. Elizabeth, I know you're on. I don't know if you came across that.
Yeah, I didn't see that anywhere. They all seem to be really interesting. Yeah, that's like
Elizabeth, we can't really hear you, but I think you said you didn't come across that.
Okay. And then I think my second question on the various state programs was sort of do we have a sense of, or any other outside metrics of pointing towards, okay, based on what we know now, we think, this program or these handful of programs really were the most successful.
Mm. You mean out of the different states that have done it, which have
Yes, and I
been
realize that's a
successful?
big survey
Yeah.
question. So I understand if it is not a known data point, but I'd be.
Yeah, I mean, so maybe that's a good segue to the last question. I'm curious what folks' thoughts are on, like, what would a metric of success look like? I have seen, I think the main one I've come across is just the straight up number of kids and parents served, which Sarah was alluding to in her remarks of about 6,000, I heard her say, and maybe it was 3,500. I'll have to go back. But so one metric, did you catch it? But any other ideas about kind of what would success look like in a program like this?
Hey, Madhu, just a couple of quick thoughts. So I think Mary Elizabeth raises a good point. The Iowa program, Harlan, I don't know if you were on the call with me or not, or if maybe you weren't with me at this time, but I know Iowa has tracked like the number of kids that have been impacted on the pilot program. Like they actually have pretty solid metrics on how
Mhm.
many local child care providers actually requested money, the amount of private dollars leveraged, and the number of kids I think impacted. So I thought that
That's
was
good to know.
pretty good. Um, just, I mean, I want to hear from Representative Crawford to get her perspective to Rhonda's question posed to us. But yeah, I mean, I think one of the principles that I put down for the working for the task force when we first started is just beginning with the assumption that we don't have money, and that's not really my take. That's Senator Bergen's, assessment. And then I think I mean, it's really difficult to try to tackle this issue without figuring out where we can find money. I think on the issue of tax credits, I mean, the Senate generally doesn't have any appetite for tax credits whatsoever. So I think that becomes difficult. But I mean, I guess my question to the group is, outside of, smaller dollars to do a pilot program, which is why we did the legislation. I mean, the only other way to find money from my perspective is, can you tie it to some kind of new revenue generating program that might be created by the General Assembly where you have dedicated dollars. But I mean, I think even to do so, I think you've got to look at different industries and sectors that are kind of emerging or becoming hot ticket items in the General Assembly. So medical cannabis is always the one that I've always thought about, and I don't really know how much traction that will have. But I believe in Louisiana, the dollars raised for medical cannabis have gone to early childhood education. Am I right or wrong about that? I can't remember. Um, and then the other idea, which I think was alluded to in this discussion, is, does it make sense to just allocate dollars to engage in a more effective lobbying effort by the business community to try to get some dollars squeezed out from the General Assembly? But I also want to get Representative Crawford's perspective on this too.
Thanks, Senator Chaudhry. I mean, I think everything you're saying resonates with me. Just, I think we're in a really interesting time, both in North Carolina, but also federally in terms of dollars that are available. Unfortunately, and by interesting time, I say maybe unfortunate, is maybe the right word to say. We're just in a place right now where dollars are really hard to come by. So I think, Senator Chaudhry's thought on, how do we attach this to something that's revenue generating, or is there something, another thought is there something that, private philanthropy could come in and seed fund some things and kind of do like a pilot type of program that becomes an example that the state says, oh yeah, this makes sense to fund, because if we invest in this, it saves us money in the long run. I will also say, like, we haven't had a super great track record with, we'll fund this thing because it'll save money for us in the long run. I mean, look at Healthy Opportunities Pilot, and I know that the Senate has had more appetite to fund that than the House, at least this past long session. So I think, I don't know that I have anything too different from what the senator had to say, other than, just what are opportunities kind of pull together private dollars that can seed fund something that become an example for the state.
Yeah, that definitely makes sense. And I appreciate both of y'all's perspectives on the very real fiscal climate that we're in with a lot of limitations. But I do think it's worth thinking through, if there is an opportunity for us to get something from private philanthropy, what's the kind of model, I think to Mary Elizabeth's point, that is balancing what's the kind of best type of program we would want to build versus, what's kind of the minimum viable product. Is there kind of a middle ground we could reach of, if we were to do this, like in an ideal world, how would we design it, and maybe kind of scale down from there? Are there any other kind of key parameters of how you've heard other states do it, that you think are, really important, that if we were to, pitch such a program, to do it in a certain way? Rhonda, I heard you make the point about, maybe 25 hours, maybe 35 is a little bit too
Yeah.
strict, but are there other parameters like that from what you've seen from what the other states have that feel really kind of important to preserve if we're kind of pitching this idea, whether that's to the general or the business community? Parameters, like, is it for all early childhood educators, or is it just for
Yeah.
teachers? Is it the age
Yeah.
range, the hours worked?
Yeah,
Rhonda, do you have
those are the
some
things I
thoughts?
was thinking about. And I wish I could see all the slides. And if you don't mind, please, because I'm looking at this in the
Yeah,
hallway in front of the elevator. Can you hear me?
we'll definitely share the
Okay,
slides
but I want to
afterwards.
so I want to take a look at all of them collectively, and I'm happy to email you,
Yeah,
just kind of my thoughts. But again, I can't say enough how grateful I am to have the representatives up here, just to weigh in on this. This is going to help us, and so one thing I want to say that Sarah said, the lady from Kentucky said, she said 38 states have been reaching out to her. Now, just personally, I'm not the kind of person that likes to come in last. I'd like to believe that out of all of these states, that that we value to say, let's figure this out, as a state. But I know that we only have a portion of the representatives up here, and they're showing that they have that concern for what we can do. So my thought is, and maybe Miss Mary, Representative, I'm sorry, Mary, I'm getting the names. I can't see your name on the screen from my, okay, so forgive me if I'm not addressing you properly. And that you kind of alluded to this a little bit, but for me, I want to, if we can put together with some information, what we feel like is absolutely necessary and needed now to show this community of parents, providers, um, in the state of North Carolina, that children and families come first, right? What can we do in the interim? And also at the simultaneously work on a long-term solution that would include more, um, private philanthropy input, that sort of thing. So in my head, I just want to be very careful about not kicking the can down the road too far, that we're like, oh, if we can, I want to, I want us to put together something that's going to, I think we keep it to age 12, because there is great concern for those school agers that are being left alone at an age that's too young because parents can't afford it or teachers can't afford it. We keep it age 12. I think we have some wiggle room to play with the hours some, and it should be. Sarah made a valid point. It has to be for everyone, not just for teachers. Because if the cook there, the directors are in the classroom, it's absolutely every person in that building is absolutely critical and essential. I can't stress that enough. So I will look at all the slides and share, and I don't know if we can have an exchange on that, where I feel
that'd be
like we have a
great.
little wiggle room to put something together. And again, I will always communicate from a lens of my peers and what I'm hearing throughout this. This is not about my programs, because we could do a little more than others. So we want to figure out what we all need as a collective, to show that we put families first, and it's families that are working and putting money back into the economy for North Carolina too. So I feel like this effort is absolutely imperative.
I agree with Rhonda that it needs to be everybody inside the school or the home. I have a question though. One of the states they just prioritize, top of the list for subsidy, I guess, for their workers. What's
Texas.
what's the wait list? If you can remind me, do you know of right now of people waiting for vouchers in the state of North Carolina? Isn't it like a lot,
It's
like
in the
10,000?
thousands. I don't know if Kimberly is on. I don't know, Kimberly, if you have that number, but I'm gonna say it's top 10,000.
Yeah.
We can get you that number,
I
but
mean,
it is thousands of families. It's
that's
very
one
long.
way to
Oh,
not add additional funding, but obviously it displaces other families.
right. Susan, did you have something?
Yeah, just a couple thought. Well, I love everybody's ideas. I think two things. I love the idea of a pilot and actually being able to show results from it. So I would look at things like turnover, people who are staying in the field, people who are more experienced staying in the field, those kinds of measures of success, and how many children are being reached by those teachers who stay in the field, and those or the staff who are in those programs. I do think we have to be thoughtful about complexity of administration. So the more sort of layers of eligibility or complexity of the mix of financing will increase what it takes to administer the program. So that's one thing I would note. And then the other thing is, I think it's really, I really do like the idea of pursuing the CCDF waiver, which would allow childcare staff to both get priority and expand the eligibility levels, but with a waiting list, how many teachers will actually be impacted, I think, would only be to the extent that, children age out or become no longer eligible and you replace them with the staff. So I think that would be a slower burn, but I still think it's probably worth pursuing. Did I just gobsmack everybody? It went completely silent.
No.
Yeah, that and we're at a transitional moment because I think Madhu had to step away to help with some other HHS related items. So I'm going to close this out for the day. So she handed the reins over to me. Does anybody else have any kind of reflection points that we can record in our notes following the example from Kentucky, or anything that you really feel should be reflected in today's discussion? Requests for further information that we can be aware of, additional insight that you think would be additive to the next time we get a work group meeting together for this area of thought. Okay. Did I lose everybody, or is everyone just really quiet?
We're here.
Okay.
We're here.
All right. That said, let's see what we have left here. We just have an appendix. So there's some additional information that we've got on Kentucky and their ECE programs that we have attached in the back. To tidy things up, first of all, the slides from today are going to be available to all of you. They're also probably going to be available on our task force website that's housed on Commerce's page. If anyone has any further reflections, thoughts, or questions that you'd like to be either reflected in notes or added to the agenda the next time we convene one of the childcare and early education for childcare workforce meetings and specific work group meetings, please reach out. Madhu can accommodate those and incorporate them into future planning. But do I see, Senator, is your hand still up? Did you have something to add, or is that from before?
It's from before. I'm sorry.
Oh, okay. Sorry, I wanted to make sure I didn't skip you. Yeah, so I just want to open that up. If anybody else has any final thoughts, we can close things out here today. Okay. Well, thank you all for participating, for bringing your leadership to this discussion. It feels good to see things heading in the right direction. I feel like we brought up a lot of really important things to follow up on here in the discussion, and I'm looking forward to keeping the ball rolling with you all. I know Madhu is as well. So everyone, feel free to keep an eye on your email, look out for notes, look out for slides, and let us know if there's anything else we can be helpful with in the meantime. A final parting thought, I think this is the one meeting of this particular work group we will be having before our next full task force meeting, which is scheduled for Monday, October 6th. It's going to be back at the Albemarle building in Raleigh, and we will look forward to seeing you all there.
Thank you.
Thank you all. Everyone have a good weekend.
Thank you.
You done? Okay, thank you. I got to go to a meeting. Thank you. Hey, you. Uh-huh. I'll stay in touch tomorrow. Okay. Oh, safe travels.